Oh, wait,
okay.
I didn't press anything.
You did. It's going. Okay, so we are taping the knee to correct patellar alignment. So this kneecap is going to be pulled medially, or toward the inside of the knee. The strap has to be long enough to go from the outer kneecap all the way wrapped around the hamstring tendon. So here, I'm going to put the tape. The white tape is just to protect the skin from the brown tape. Yay. Get my hands on. And if you want to pause it for a sec.
Okay, what do I do?
Just hit pause.
Down there.
You got to use your actual skin. Okay, so we do this with the leg completely straight. The white tape goes, so if here's the kneecap, and I can feel the edge of that kneecap, the white tape goes to the outer edge of the kneecap and then wraps around the medial hamstring. And then we take the brown tape, and the brown tape is going to actually move the kneecap and tilt the kneecap like a seesaw. So the medial side is going to go down as the lateral side goes up. So we put pieces of the brown tape over the top of the white tape. It's important that the brown tape doesn't touch your skin. The brown tape can touch white tape, but it can't touch your skin. So if here is the kneecap, so if we drew, here's the outside of the kneecap. If we drew an imaginary line through the center of the kneecap, the middle of the brown tape goes right in the center of the kneecap, top to bottom and left to right. So you're just going to anchor that on there, and then we're actually going to pull, create a pulling. And I'm feeling for that this brown tape wraps over white tape. So see, then we've moved the kneecap a little to open up this space. Get another piece.
Smile, you're on candid camera. Or I've been punked.
You've been punked. So now we're going to do just the bottom edge a little bit. I'm still over the kneecap, and I'm pulling pretty firmly, medially, and wrapping it around. I'm sweeping it up just a little bit. I'm sweeping from here up the thigh, because you do have a little bit of an inferior polar rotation, although that's a lot better. When I feel the top of the kneecap and the bottom of the kneecap, an inferior polar rotation would be this turned out, but you've corrected your thigh position so much that that's a lot more improved. One more piece, I think. This one, I'm going to anchor it here. I'm pointing it downward, and then what I'm going to do is I'm going to spin the kneecap upward, making sure that we're still on the white tape. And then what I want to feel, we know the tape's in the right place if you have less pain when you stand and walk, but also so there's a little space in this groove between the kneecap and the thigh bone. So if you move that kneecap, feel me, you can move it, because it's a good thing to move the kneecap. There should be space so that's not bone touching bone. So that's your patellar tape.